Rachael Cowan, a physiotherapist here at Olympic Park Sports Medicine Centre in Geelong. I also work with the Australian women's football teams, primarily the Young Matildas. Today I'd like to talk to you about a topic I'm covering as part of my PhD at La Trobe University. I'd like to share some helpful tips in case any of this sounds familiar to you. So my research topic covers the gluteal muscles and tendons, which are muscles in the buttock area and attached to the side of the hip via what we call gluteal tendons, so into this area here. When we get pain in the area of the gluteal tendons, it's referred to as greater trochanteric pain syndrome or gluteal tendinopathy. You may also hear it referred to as trochanteric bursitis. So this condition is experienced all over the world. It's often poorly managed and underdiagnosed. It can occur in both athletes and non-athletes and occurs in men and women. It is more common in women and in particular postmenopausal women, and this is due to their pelvic bony structure, changes in hormones and generally an increased body fat composition compared to men. During the COVID-19 period, we've all adjusted to a new way of living. We may have started a new sport or activity, returned to an old activity after some time away, changed your training load, or maybe spending more time at home, resulting in increased time sitting or lying around. In addition to this, gyms have been closed, so a lot of you may not have been able to continue your normal strength or maintenance routine. So if you're experiencing injury after a change in load, you're not alone, because unfortunately tendons don't like a sudden change in load. What we do know is education surrounding avoidance of gluteal tendon compression is key to managing this condition. And education in combination with any appropriate exercise can achieve great results. And it can be as simple as adjusting some of your daily habits or activities to ensure that you're not compressing those gluteal tendons at the side of your hip. So if you're experiencing pain at the side of your hip, here are some helpful tips to get you started. Avoid sitting with your legs crossed. Sit with your hips higher than your knees where possible, and this can be as simple as placing a rolled up towel at the back of your chair. Sleep on your back or on your good side with your sore hip facing up and place a pillow under that top leg. Stand evenly on both feet. Avoid stairs in the short term and continue exercising as tolerated, but we don't want an increase in pain that night or the following day after the activity. And if you'd like further advice specific to your injury, come in and see myself or one of my colleagues in clinic. We are available during the COVID-19 pandemic and following a high level of infection control. And we are available for telehealth consultations where preferred. Stay safe, stay well, and stay fit.